Imagine a universe teeming with life, not just on distant planets, but right here on us and within us. This is the microbial cosmos. Trillions of bacteria, tiny life forms, engage in a constant silent ballet. Some are essential allies, partners in our biological journey. Others, however, are invaders, microscopic marauders capable of disrupting our delicate internal ecosystems. For eons, humanity faced these invaders with limited defenses. Infections could be devastating, entire populations vulnerable to unseen enemies. The discovery of antibiotics fundamentally changed our place in this microscopic war, offering us powerful shields and weapons. It was like discovering a new law of physics, one that allowed us to fight back effectively. Among these remarkable discoveries, certain compounds stand out for their ingenuity and effectiveness. Augmentin is one such champion in our medical arsenal. It's not just a simple antibiotic, it's a clever combination, a dynamic duo designed to overcome some of the more cunning defenses bacteria have evolved. Think of it as a specialized tool crafted for specific challenges in the ongoing battle against harmful microbes. Understanding augmentin is like understanding a celestial mechanism. Complex, yes, but governed by knowable principles. Its introduction represents a significant step in our ability to protect human health, a testament to scientific exploration applied to the very fabric of life itself. We are, in a sense, explorers of our own biology, charting a course through the vastness of medical science. The importance of antibiotics cannot be overstated. They are the cosmic guardians of our health, allowing us to navigate a world filled with potential microbial threats. Before their widespread use, a simple scratch could spiral into a life-threatening infection. Surgeries were far riskier endeavors. Diseases like pneumonia or tuberculosis claimed countless lives. Antibiotics transformed medicine, extending lifespans and improving the quality of life for billions. They are a cornerstone of modern healthcare, silent protectors working at a scale almost too small to comprehend, yet their impact is astronomically large. We must, however, wield this power with wisdom and respect, lest these microbial adversaries evolve beyond our current understanding. Augmentin, therefore, enters this grand narrative as a significant player. It represents a more advanced strategy in antibiotic therapy. Bacteria are not static. They evolve, they adapt. Some develop shields enzymes called beta-lactamases that can neutralize common antibiotics. Augmentin was conceived to bypass these defenses. It's a molecular solution to an evolutionary problem. Its story is one of scientific insight, a targeted approach to ensure our treatments remain effective. It's a reminder that the universe of medicine is constantly expanding, with new discoveries illuminating the path toward better health and a deeper understanding of life's intricate machinery. We continue to learn, to adapt, just like the universe itself. To truly understand augmentin, we must first explore its classification, its place in the vast library of medical compounds. Therapeutically, augmentin is classified as an anti-infective. This is its broad mission directive to combat infections within the human body. It's a frontline defender, sent into the biological battlefield to target and neutralize harmful bacterial invaders. Think of this classification as its job description in the cosmic theater of health. Its role is to restore balance, to push back against the microbial forces that seek to disrupt our well-being. This therapeutic category encompasses a wide range of agents, each with its own unique properties and targets. And augmentin holds a specific, powerful niche within this group. Pharmacologically, augmentin is a bit more complex, a fascinating combination. It contains two active ingredients, each with a distinct role, like two stars in a binary system. The first, amoxicillin, belongs to the penicillin class of antibiotics. Penicillins are a venerable family of drugs, pioneers in the antibiotic age, known for their ability to interfere with bacterial cell wall construction. The second ingredient, clavulanate potassium, or clavulanic acid, is classified as a beta-lactamase inhibitor. This is the clever part. Clavulanate itself isn't a powerful bacteria killer, but it acts as a bodyguard for amoxicillin, protecting it from certain bacterial enzymes that would otherwise destroy it, making the combination far more potent. So why is augmentin prescribed? What are its specific indications? Doctors turn to augmentin when they suspect or know an infection is caused by bacteria that are likely to be resistant to amoxicillin alone. These infections can manifest in various parts of the body. Common targets include lower respiratory tract infections like bronchitis and pneumonia. It's also frequently used for sinusitis, those troublesome infections in the cavities around your nasal passages. Ear infections, particularly in children, otitis media, are another common indication. Furthermore, augmentin is effective against certain skin and skin structure infections, as well as urinary tract infections, showcasing its versatility. The universe of bacteria is diverse, and some have evolved sophisticated defense mechanisms. One such defense is the production of beta-lactamase enzymes. These enzymes are like molecular scissors, snipping apart beta-lactam antibiotics like amoxicillin before they can do their job. This is where augmentin's dual-action design shines. By including clavulanate, augmentin can tackle bacteria that would otherwise shrug off amoxicillin. This makes it a valuable tool against a broader spectrum of bacteria, especially those that have acquired resistance. It's a strategic move in the evolutionary chess game we play against these microscopic organisms, ensuring our treatments remain one step ahead. How does augmentin actually work its magic at the molecular level? Its mode of action is a tale of two components. Amoxicillin, the penicillin part, targets the bacterial cell wall. Bacteria, unlike human cells, have a rigid outer wall that is crucial for their survival and integrity. Amoxicillin interferes with the enzymes responsible for building and maintaining this wall. Imagine trying to build a starship without the right rivets. The structure becomes weak and eventually collapses. This is what amoxicillin does to bacteria, causing them to lyse or burst. It's a direct assault on their fundamental architecture, a precise strike at a vital component, but many bacteria are wily. They've evolved beta-lactamase enzymes, tiny molecular shields that can neutralize amoxicillin. This is where clavulanate potassium, the beta-lactamase inhibitor, steps in. Clavulanate itself has weak antibacterial activity. Its primary mission is to seek out and bind to these beta-lactamase enzymes, effectively deactivating them. It's like sending in a specialized unit to disable the enemy's defense systems. By neutralizing these enzymes, clavulanate allows the amoxicillin to perform its cell wall destroying mission unhindered. The therapeutic effect, therefore, is the eradication of the susceptible bacteria and the resolution of the infection, allowing the body's own cosmic defenses to restore order. However, like navigating an asteroid field, using augmentin requires awareness of potential hazards. There are contraindication situations where augmentin should not be used. The most significant is a known hypersensitivity or allergy to amoxicillin, clavulanate, or any penicillin-type antibiotic. An allergic reaction can range from a mild rash to severe, life-threatening anaphylaxis. It's a cosmic red alert. Additionally, individuals who have previously experienced cholestatic jaundice, a type of liver problem causing yellowing of the skin and eyes, or hepatic dysfunction associated with augmentin use, should not take it again. Caution is also advised in patients with severe kidney impairment, as dosage adjustments may be necessary. Even when used appropriately, augmentin can cause side effects like turbulence during space travel. Common side effects are often gastrointestinal in nature. These can include diarrhea, nausea, and sometimes vomiting. These occur because antibiotics can disrupt the natural balance of bacteria in our gut, the good microbes that aid digestion. Skin rashes and yeast infections, oral or vaginal, can also occur. These effects are usually mild and may resolve on their own or with simple measures. However, it's important to be aware of them and to communicate with a healthcare provider if they become bothersome or persistent. Understanding these potential disturbances is part of responsible antibiotic use. The route and dosage of augmentin are determined by the captain of your medical ship, your doctor. It depends on the type and severity of the infection, your age, weight, and kidney function. Augmentin is most commonly administered orally, available as tablets, chewable tablets, and a powder for oral suspension, which is often used for children. For more severe infections or when oral administration isn't possible, augmentin can be given intravenously, IV, directly into the bloodstream. This IV formulation, often seen as a powder reconstituted into a solution, allows for rapid delivery and high concentrations of the drug to fight serious battles within the body. The precise dosage and duration of treatment are critical. It's a carefully calculated trajectory. Let's consider the augmentin injection in more detail. When an infection is severe or spreading rapidly, Or if a patient cannot take medications by mouth, intravenous augmentin becomes a crucial option. The medication typically comes as a sterile powder in a vial. This powder must be carefully reconstituted, usually with sterile water for injection or another suitable diluent, by a healthcare professional. They will draw the correct amount of diluent using a syringe and inject it into the vial, gently mixing until the powder is fully dissolved. The resulting solution is then administered, either as a slow injection over several minutes or as an infusion over a longer period, ensuring the medication enters the bloodstream safely and effectively to reach the site of infection quickly. Patient and family teaching is a vital part of the augmentin mission. It's like providing an astronaut with their flight manual. Always take augmentin exactly as prescribed by your healthcare provider. Do not skip doses and, crucially, complete the entire course of treatment, even if you start to feel better. Stopping early is like aborting a mission prematurely. It can allow the hardier bacteria to survive and multiply, potentially leading to a recurrence of the infection or the development of antibiotic resistance. Augmentin, especially the oral forms, can be taken with or without food, but taking it with a meal or snack may help reduce potential stomach upset. Store the medication as directed, away from moisture and heat. In conclusion, augmentin is a powerful tool in our ongoing exploration and defense of human health. Like any advanced technology, its effectiveness relies on its proper use. Following medical advice is paramount. Report any severe or unusual side effects to your doctor immediately. Understand that antibiotics target bacteria, not viruses. They won't help with a common cold or the flu. The responsible use of antibiotics like augmentin is a shared cosmic responsibility. It helps preserve their efficacy for future generations, ensuring these vital tools remain available to combat the ever-evolving microbial universe. Listen to your healthcare provider. They are your navigators in the complex journey of health and healing.